Good afternoon. I would like to thank the International Union for the Scientific Study of Population, IUSSP, for the invitation to speak at this event at the Africities Summit in Kisumu. I would have loved to be with you in person, but with a positive COVID-19 test last Friday, I could not put any of you at risk by trying to be there in person. I hope you'll all be safe at the meeting. I would like to appreciate our chair, Honorable Esther Passaris, the Nairobi County Women Representative, as well as my co-panelists, especially Honorable Log Setonji Atropo, the President of the Association Nationale des Communes de Benin and Mayor of Cotonou. Reproductive health and family planning are not the usual thing that mayors and city officials concern themselves with when they meet to discuss development issues in their city. There is no doubt that hard infrastructure like roads, housing, water and sanitation projects are important, and they are needed in cities across Africa. Africa currently has a 60% shortfall in annual infrastructure financing bill, according to the African Development Bank. At the rate of growth of our cities, no amount of investments in infrastructure will keep pace with the growth of cities in Africa, especially secondary cities like Kisumu. So our best efforts at meeting basic urban amenities and services like education, healthcare, jobs will only result in dissatisfaction because, based on what people can see, these services and amenities will continue to fall behind the growth of cities, meaning we will continue to have worsening coverage of these services. Since we are in Kisumu, let us start by taking Kisumu as an example of this rate of growth of urban cities in Africa. In 1970, that is 52 years ago, the total population of Kisumu was 37,000 people. In 2022, it is 379,000. That is more than a tenfold increase over the 52 years. This simply means that the population of Kisumu has doubled every 5 years for the last 52 years. Over the next 13 years, the population will increase by 63% to about 620,000 people. So, in just 13 years from now, as the mayor of Kisumu City, you will need 63% more schools, more teachers, hospitals, doctors, nurses, roads, houses, jobs to meet the current levels of these services, which are inadequate. So despite how great your city planning office might be, you simply do not have enough time to develop the systems that will support that level of growth of the city. Kisumu, unfortunately, is not alone in this type of growth. In fact, it is not even among the fastest growing cities in Africa today. Over the 15-year period between 2020 and 2035, these 15 cities in Africa will at least double their 2020 population size. Many of these are what we call secondary cities. They are not the capital cities of their countries. I can even say that many of us may not have heard of many of these cities. Cities like Zinda in Niger, Songea and Mwanza in Tanzania, Gwagwalada in Nigeria, Uge in Angola, or Tete in Mozambique. Again, It is impossible for any city to improve the key human capital development indicators like healthcare, education, decent jobs when the city's population is doubling every 15 years. But what is driving this level of growth? For most people, the first thing that comes to mind is, oh, it's rural-urban migration. People are leaving the large cities and they're coming to the smaller cities, like leaving Nairobi to come to Kisumu because of devolution and other examples and reasons we can give. Surprisingly, that is not accurate. Most of the growth in urban Africa today, in fact, as high as 70% of the growth in urban areas in Africa is due to natural increase. Natural increase is the difference between the number of people being born in the city in a year and the number of people dying in the city in the year. This difference is what is driving the growth of cities in Africa. So, to understand the cause of rapid growth of cities in Africa, we have to understand the role fertility plays in urban growth. Over the last 30 years, we have made remarkable progress in reducing child deaths and maternal deaths and deaths from HIV and other diseases. But fertility in urban areas has remained relatively high. This has created a pattern of very rapid growth of the population in urban areas. Surprisingly, most of the births in urban Africa are unplanned or unwanted. In some countries and cities, more than half, that is 1 in 2 recent births, were reported to be unwanted or unplanned, and nearly 1 in 4 women who would like to stop childbearing altogether or delay the next birth by at least 2 years are not using any modern method of family planning. This problem is often worse in secondary cities, which is where most of the urban growth in Africa is occurring. For example, in Kenya, the 2014 DHS survey shows us that 47% of recent births in small cities were reported as unplanned or unwanted, compared to only 28% in large cities. Even compared to rural areas, women in smaller cities are more likely to report their recent births as unplanned or unwanted. In South Africa and Namibia, more than half of the recent births were reported as unwanted or unplanned in both urban and rural areas. In most recent DHS surveys, they have stopped providing information on size of cities. So going forward, we will not be able to examine these types of differences by size of city or level of urbanization. It is not only that fertility is high, but the fact that it is largely unwanted and unplanned means that most women with unwanted fertility will resort to abortion, which is largely unsafe and contributes to both maternal deaths and poor child health outcomes. More importantly, urban areas are generally more youthful, and age at first birth in urban Africa is often quite low, meaning that the gap between the generation of mothers and the generation of daughters is often too short. This fact actually compounds the growth of the population. I will come back to this point later because it is very important that we understand it. And this is where family planning comes in. As high as 25% of currently married women who are at the risk of getting pregnant and who do not want any more children or want to wait at least 2 years before the birth of their next child are not using any modern method of contraception. This phenomenon, called unmet need for family planning, is often generally higher among poor urban women for whom the cost of contraceptive commodities makes such services out of reach to them. It is also higher in secondary cities than in large cities. Meeting this gap alone can reduce almost 40% of the growth of cities in Africa. Some of the work we did recently showed that the differences between the rich and the poor in terms of the level of contraceptive use has virtually disappeared in urban areas in East and Southern Africa. They remain very strong and have even increased in most of Central and Western Africa. If you look at the 2003 to 2007 period, about almost all the countries in East and Southern Africa, as well as in West and Central Africa, had huge gaps. Between the 2013 and 2019 period, that gap has disappeared in all the countries in East and Southern Africa except Ethiopia and Uganda. In West and Central Africa, the gap has remained, and in some places it's even become much stronger, like in Mali. We also found that the disappearance of the rich-poor gap in contraceptive use in East and Southern Africa is related to massive increases in the proportion of poor urban women receiving their contraceptive commodities from public health facilities. In East and Southern Africa, large proportions of the urban poor women who use modern contraception obtain their methods from public health facilities, and this has actually increased over time, often doubling over the past 10 years in countries like Malawi, Rwanda, Uganda, and Zambia. In West and Central Africa, public health facilities play virtually no role in providing poor women with access to modern contraceptives. Consequently, the level of contraceptive use among the urban poor remains very low in West and Central Africa, and in many countries it is below 10%, like in Chad or Mali, Guinea, DR Congo, Benin Republic, and Nigeria. And in these countries, services are not just there in the public sector. Very many poor women are not able to get their services from the public sector. The United Nations Population Division releases their population projections of the global, regional, and national populations for now up to the year 2100, and they've been doing it since the 1960s. Every time they release this projection, it is noted that the population of Africa shoots up from where it was originally projected to be. If you look at the example of Niger in the chart, the red line showed what the 1996 projection showed, that by 2050, the population of Niger will be around 37 million. The most recent revision is shown in blue, which is the 2019 revision. It actually shows that the population of Niger by 2050 will be about 70 million people. That's almost double the earlier projection barely 20 years ago. What is causing this large difference? And what does it mean for cities in Africa? In Niger, like in many other African countries, women start childbearing very early, many times before the age of 18. You can compare this to Europe and East Asia, where women on average start having children at about age 32. If we do not do anything at all about the number of children that women have, let's assume that women in Niger and in South Korea have exactly the same number of children. And the only difference is that women in Niger start at 18 and those in South Korea start at age 32. In 90 years, there will be 5 generations of women in Niger and 2.8 generations of women in South Korea. That means in 90 years, without affecting the average number of children women have in Niger or in South Korea, meaning they are exactly the same number of children, the population of Niger will still be 78% larger, simply because of the compounding, the shorter intervals between the ages of mothers and their daughters means that you have many more generations over that period of time. However, in addition to this compounding effect of early onset of childbearing, when women start having children early, they actually end up with a lot more children than if they started childbearing later. They are also less likely to continue with their schooling, less likely to work outside the home, and less likely to have children who go to school. Our population in Africa is very young, especially in urban areas. If, as a city official, you do not have any programs that help young people to delay their entry into childbearing, your city will continue to grow much faster than you can plan for it. Family planning is the cheapest planning tool to manage urban growth. And in Africa, you will simply be meeting the demand that is already there. It is the most sensible thing for any city official to support. And the question is, what are you doing about it in your city? What will you do about it when you get back? So what am I saying? Family planning is one of the most important investments you can make to improve the lives of the citizens of your city. It has very immediate benefits in reducing maternal mortality because women who do not get pregnant do not die from childbearing. And women who have an unwanted pregnancy are more likely to resort to abortion and to die from it, given that we have very poor access to such services across Africa. It will help the mothers to take better care of their children when they use family planning and they're able to space their children apart. And that will improve child survival. It will delay early start of childbearing, which will make the population grow slower to buy you time to put in place appropriate infrastructure and planning to support proper growth of your city. In the long term, it will make every penny you spend on health, education, child nutrition, or creating decent jobs go much further because the number of people requiring such services are not growing faster than your government's ability to respond to them. Just think for a moment. What if you did this 5 years ago and you were able to avert 40% unwanted fertility in your city? You may have today 40% less children wanting a space in your kindergarten class. Imagine what a relief that could be for your early childhood development program. I can go on, but what is important is for you to recognize that family planning is one of the best investments you can make to support development in your city. Thank you.